right? So that's pretty obvious. And then from the brachiocephalic trunk, okay, in the pig we get not only the, right subclavian artery, but then we're also going to get the two common carotids. So this is the right common carotid artery. This is the left common carotid artery. All right, not all pink like they should be, but close enough. And then the second branch off the arch of the aorta back here, all right, it might be a little tougher to see if you're not close, is the left subclavian artery. All right, that's the left subclavian artery. Now, if I have a little more time, I will work on trying to clarify the subclavian arteries, both of them. All right, once they cross the first rib, they move into the axillary region. All right, and when that vessel is found in the axillary region, its name takes on the name of the region, right? So it goes from being the subclavian artery in the thoracic cavity to the axillary artery out here, okay? All right, outside of the thoracic cavity. As that vessel continues then to move, and this is where I'll need to clean it up some more, all right? And I'll do that while you guys are working. But as you continue then to move along, right, that forelimb, as you get out a little further along the forelimb, then we identify the vessel as the brachial artery, all right, the brachial artery. And we don't go beyond that, okay? That's more than I think most instructors do anyway, all right? So the other thing that you'll notice when you find the axillary artery, and look, again, some of these smaller vessels, little small vessel, not important. You can pull through that, all right? We're trying to preserve, right, the big one. So don't pull through anything until you're certain it's not, all right, something that you're supposed to know. So this larger vessel here, all right, is the axillary artery. And again, if I clean this up a little bit more, you'll be able to see it more clearly coming up and over. Okay? The other thing that I was going to point out, although again, it may be a little difficult to see, but remember, all of these little colorless strands that you see, all right, all of these little colorless strands here, these are nerves, right? These are nerves. This is part of the brachial plexus, all right, part of the brachial plexus here. Okay, so you may have talked about that regional plexus in A&P1, all right, the brachial plexus. All right, so anyway, I'll try to do a little bit more work up here to make some of those vessels a little easier to see. In terms of where you want to get today, we want to work now down into the abdominal pelvic cavity. Okay, so most of you probably made your incision somewhere around the level of the diaphragm. Now what you're going to want to do is you're going to want to make a cut, all right, essentially through the, through that ventral body wall down towards the tail. Okay, and you want to go around. All right, you want to go around the umbilical cord, okay? You can do that first if you want. Remember, again, with your scissors, right, I want to use the blunt end. Going to put that down, and then a little upward pressure. Shouldn't be any issue. It's not too tight or anything here. But that little upward pressure makes sure you're not cutting down and damaging, all right, vessels. And you're just going to cut down. All right, upward pressure again. Right, and just careful not to cut too deep, right? Cut a little ways, stop and look, all right? So there's a vessel here you want to know. There's an organ there that you're going to want to know, all right? And we kind of cut our way down here. Remember, you can always cut more. You can't uncut. So, you cut down that way, okay? And now we can see into, right, the cavity a little bit more. To really get into the cavity, though, what you're going to need to do, if you haven't done so already, is you're going to need to cut the diaphragm away from the body wall. All right, so cut that diaphragm away from the body wall. I try to keep it so that it's generally in its natural position. That way you know that that's the diaphragm. You can see the delineation between the thoracic cavity, that's cranial to it, and the abdominal pelvic cavity kind of caudal to it. All right, continue to do the same, cut along the body wall. Okay, bit of a blowout here with latex. Okay, you may find the same thing. You may also get down here and there may have been vessels that ruptured, and you may have coagulated blood, which is going to be kind of brown, just kind of make it a brown kind of mess down here for you. Remember that blood, as it oxidizes, becomes kind of brownish in color, and it can be all over the place. don't be afraid to bathe your pig. They like baths, all right? So bathe your pig if you need to. You're going to need that, especially if you want to see anything against the posterior or dorsal body wall, all right? In this case, right, they had a miss or, you know, maybe a vessel rupture. You can just pull the latex, all right out. Usually fairly easy to go ahead and remove if that's the case. Okay, this here is the umbilical vein. All right, the umbilical vein. You want to clip the umbilical vein. What I would do is I would clip it close to that ventral body wall so that some of it still kind of sticks out away from the liver, and that way you know where it is. Okay, so the umbilical vein there. All right. The other thing that you might want to do, especially if you have a male pig, all right, is, you know, for male repro that we'll do in a couple of weeks, we want to be able to identify the penis. Okay, so you cut along the other side of the umbilical cord, all right, like this, back down, and then you can. All right, now you can access more easily, again, the abdominal pelvic cavity, and for those of you that have a male, you're still going to have a relatively easy time finding the penis. If you just kind of cut across the bottom here and remove that, you're going to, you know, Lorena Bobbitt's gone, all right, not going to see it, okay, for those of you that okay, don't know that reference, doesn't matter. Cut the penis off, all right, and it's lost. Go throw it in a field. Cutting it off? No, I'm not. No, this is. This is a male. Yeah, it is a male. Yeah, it is a male. Right, urogenital opening right here.
Okay.
Right?
Okay, that's right. That's right.
So yeah, it's there. But it takes a little work. All right, it takes a little work back here to go ahead and reveal that, and I'll save that surprise for, you know, for another day. All right, it's here in the wall. But anyway, once you do that, right now you got a little more access. What you can do, again, kind of safely through the body wall, up here just cranial to, you know, cranial to the hind limbs, is you can cut down through that body wall. And again, be careful not to cut, all right, any of those organs, right? That'll open it up a little bit more for you. Do the same thing the other way. Okay, hopefully your scissors cut better than mine. All right. That's good enough. All right. Now it's wide open. Right now it's wide open for you. So there's the diaphragm. There's the diaphragm. Right. This whole thing is the liver. Okay. Whole thing is the liver. You can lift it up. All right. All of these lobes. Right. Lobes of the liver. Okay. Still a little bit more latex in there. Associated with the liver, right, is another kind of accessory organ of the digestive system. The gallbladder stores bile. Right. Bile is actually made by the liver, stored in the gallbladder, right? So usually under, you know, the lobe on the right side of the liver, this kind of anterior lobe, you can go ahead and find the gallbladder, right? So right here, it's kind of nestled into a little fossa. Okay, I can't really pull that out too far, but you can see gallbladder. Okay, right here.
Yeah,
okay, I'm sorry. I'm coming back up. All right. Okay, so that's gallbladder. Now, you know, you just kind of move the liver up a little bit, right? This big pouch that you see here, right? That's the stomach. Okay, I wouldn't open up the stomach or the small intestines. Try not to cut into it too much. All right, there is kind of waste in there called meconium. It's green. It's sticky. It just sticks to everything, and it's just kind of gross. So. You know, I would just be careful with the digestive tract, if you will. But that's the stomach. Again, you're going to have a hard time, at least for the purpose of today, you know, trying to find the esophagus and where it connects. So don't worry about that. But, all right, again, where that stomach begins to narrow as you're moving in this direction, right, kind of towards the right side, if you will, of the body. All right, here we have the duodenum, this initial little short portion of the small intestine right here. Okay, this big knot right here, and you can feel that, all right? That big knot right there is the pyloric sphincter. Okay, that's the pyloric sphincter. All of this then, all of this kind of, you know, beige tubing is the small intestine, right? I would say, no, this first initial little U-shaped part is the duodenum, all right? That's easy enough, right? Just on the other side of the pyloric sphincter. All right, this is all just small intestine. Look, if you flare it open, right, remember all of that tissue connecting the different regions of the small intestine, right? That's the mesentery. These are small branches of what's called the cranial mesentery or the superior mesenteric artery. All right, so these are blood vessels here. Okay, and then, you know, it's going to weave its way around and around, and eventually, all right, it's going to hook up with the large intestine. Now, all right, you can usually find that the large intestine begins with the cecum. All right, this can sometimes take a little work to find. Those of you that the first group to find the appendix in the fetal pig off of the cecum gets $1. They don't pay very much, so I feel generous giving $1. No, I'm joking. Actually, I waited too long to tell that joke because here's the cecum. There's no appendix, so it's a bet I've never lost. All right. It was interesting to see what people would tell me was the appendix, but this is the cecum, right? It's just a blind-ended pouch, right? It looks like the head of an earthworm. All right. That's how the large intestine begins, is this little pouch, right? The cecum, and you can sometimes then find that portion of the small intestine, right? You see all this thin beige, coiled tube. Again, that's the end of the small intestine. That's the ileum. You can kind of see where that meets up there, hooks up with the large intestine. Now, large intestine is organized very differently, obviously, in the pig than it is in humans. All of this big green tubing is large intestine or colon. Okay? We don't have a spiral colon, right? That's what this is. It's called a spiral colon, right? But that's part of it. Okay? Let's see. What else? If you kind of displace things to the side a little bit, you can get back and see the, posterior body wall. Now, it needs to suck up a little juice back here, a little bit. But, well, there's other organs here. All right, so that's small intestine, mesentery, large intestine or colon. Let's do right here. This kind of looks like a tongue. All right, this brown organ right here is the spleen. All right, so this is the spleen. The pancreas is fun. So for the pancreas, again, you're going to use the probe, and look, just this tissue. It just seems connecting things, right? I'm not digging it into an organ and pulling through. I'm just teasing away some of the tissue that has everything connected. And when you tease away that tissue, okay, some peritoneum there, all right? You see this kind of granular looking organ back here. See this kind of grainy organ right there? That's the pancreas. All right, so that's the pancreas. Okay, let's see. I think the only other organ that I'll maybe mention at this point, and then the rest of it can be mentioned another time, blood vessels and repro. This is the urinary bladder. All right, this is the urinary bladder. Okay, so right here, right, urinary bladder. These vessels are actually umbilical arteries. All right, one of the things that we'll do moving forward is we'll work along that posterior body wall to identify the inferior vena cava, to identify the abdominal aorta, and then to look at the 4 branches, all right, off of the abdominal aorta. 2 of them are these umbilical arteries. The other 2 are called external iliac arteries. So anyway, all right, that's most of what you got.